Health officials have now been distributing Pfizer's COVID-19 vaccine for a few days in KELOLAND. Sioux Falls doctors expect the Moderna vaccine to arrive early next week. KELOLAND's Tom Hansen kicks off our team report as he asks an Avera doctor some of the biggest questions surrounding the safety of the vaccine.
It's what we've all been waiting for, a path to ending this pandemic that has impacted just about every aspect of our lives. Tonight, we tackle some of the questions that you might have when it comes to the vaccines now being considered in South Dakota. For instance, the vaccine was fast-tracked into production. Does that make it any less safe?
And the answer to that is no. So the data that we have is really pretty good, and vaccines almost never have a delayed onset of adverse effects. It's things like serious allergic reactions that happen really quickly after the vaccine. What we have seen and what remains to be seen, that shortened period of getting the vaccine to market, we really don't know how long this vaccine is going to be effective.
Avera Vice President of Clinical Safety, Dr. David Basil, says as time goes on, we'll find out if booster shots are needed in, say, 6 months to a year. How will you feel after you get the vaccine? Well, some people may become tired, experience some muscle aches, and a low-grade fever. They will also feel a bruise-like pain on their arm where they got the shot. Doctors say this is normal and is your body's immune response to the virus. This would last a day, maybe two. However, doctors say a small percentage of people may have a stronger response to the vaccine and may have to stay home and rest. Is one vaccine better than the other? Dr. Basil says he hopes to get more information on the Moderna vaccine later this week, but preliminary data suggests that they're pretty much equal. Basil says that he considers them interchangeable at this time. Both vaccines require 2 doses, and as far as his personal choice when it comes to be vaccinated, he says he'll take either. What if you have allergies? Anyone who's had a serious allergic or anaphylactic reaction to an injection should not get the vaccines at this time.
Lesser allergic reactions, or if you've had even anaphylactic reactions to oral medications or serious allergic reactions to food or environmental allergies, the recommendations are let us know that so that we can observe you for 30 minutes after your vaccination instead of 15, because this type of serious allergic reaction shows up very quickly, and so if it's not going to show up in that first 30 minutes, then it's not going to happen.
What if you are pregnant? Dr. Basil says the official recommendation is it's probably safe, but it hasn't really been studied. He advises expectant mothers to have a discussion with their doctor about the risks versus the benefits. In Sioux Falls, Tom Hansen, KELOLAND News.
Coming up tonight on KELOLAND News at 10, Dr. Basil will answer even more questions about the vaccine.